Welcome back to On The Beat, everyone. I'm over here with Dr. Barry and Dr. Debbie from Monroe Regional Hospital, and we're talking all about their therapy services that they have, and in particular, it is all about physical therapy. Now, I know I personally get confused with all the different terminologies when it comes to the medical field, so break it down for our audience at home. What is physical therapy?
Well, you know, physical therapy in essence is it's an allied health practice, and our specialty is to promote mobility and improve function by remediating impairments.
Okay, so what if I'm sitting at home and I'm feeling a little bit of discomfort or a little bit of pain, before I pick up the phone, what should I be explaining to you, or what should I be feeling before I walk in?
Well, you should be feeling that you're going to get better when you come to see the therapist. If you're having problems reaching up in the cabinets with some shoulder injuries, back pain, knee pain, it doesn't matter. We treat the entire body.
Okay. All right, so how does physical therapy differ from chiropractic work?
Simply, chiropractic's more of a manual practice,
okay,
and that it's more hands-on. And physical therapy is more of a learned practice where the patient is more involved.
All right.
To where it's kind of it's more of a one-on-one approach with the patient.
So would I be correct in saying it's a bit like rehabilitation?
Yes, that's correct. And we do some manual therapy as physical therapy. We do some hands-on.
Okay.
We use therapeutic exercises, therapeutic modalities, and we do some manual therapy. So whatever there is, if there's an injury or rehab problem that you have, physical therapy can address those physically.
Okay, well, maybe I'm sitting at home and I don't have a local doctor, but I am experiencing these symptoms that you're talking about. Am I able just to call you and walk in, or do I need a referral?
Well, normally you do need a referral to see physical therapy, but there are some certain circumstances that you do have direct access to your physical therapist in Mississippi. We're limited with that access. You can come in with certain diagnoses and you can call us and we can go over those with you. But as long as we get that plan of care back to the doctor within 15 days, we'll be okay.
All right, well, I'm sure everyone's sitting at home. I've never been through physical therapy, so I'm not quite sure what's involved in that as having the feeling of that physical therapy. But how long would I see some sort of result once I'm working on the area of that particular pain or issue?
Well, certainly that's body part specific. If we're dealing with the back, it may take a little bit longer. If we're dealing with a hand or an elbow or a knee, it may not take as long, maybe 4 to 6 weeks on average.
And would that be on a weekly, daily, couple of times a week? How does that work?
It just depends on, sometimes the doctor gives us prescriptions if they want them to come 2 to 3 times a week. Sometimes we decide what we think they need and we converse with our doctor with that. But we like to think that when they first come in, that we'll let them go out that day feeling better than they did when they came in.
Well, that's living a better life. That's what you're all about. Let's break it down. Now, we know that, you know, there's conversations about when adults have physical therapy, but what about children? And then we're going to jump into infants. What age brackets for
Absolutely.
children?
Well, physical therapy is it's a lifespan, from infancy to geriatric.
Really?
Yep. From diapers to diapers, as we say.
Okay. So you said infants. Yeah. So what age, or how would you know that an infant might need physical therapy?
Well, when the infant is born, they're screened and they have to go through certain tests. And if they don't meet all their criteria in that test, that shows different signs that they might need some therapy. They might need some joint mobility. They might need some type of developmental program to help them along.
Okay, now, very quickly before we head to break, any pain while we're having this done, or should it feel like a massage?
You'd like to think so. There should be some immediate relief.
Right,
but
so there's a little bit of discomfort.
There is some discomfort involved.
And probably some soreness. If we're doing our job, you'll probably have some soreness, but that soreness will work itself out as we continue through the program.
Well, again, thank you so much. I can't wait to delve a little bit more into what you're doing. If you want to find out more information, there it all is up on the screen, everyone. Monroe Regional Hospital, the place to go for that extra care. Back after this short break, you're watching On The Beat.